All right, it's time for nutrition as it is a Wednesday morning. And joining us to talk about the topic nutritional management in Alzheimer's disease in honor of International Alzheimer's Day is Vivian Ifoma Okorocha, a registered and practicing dietitian who is passionate about healthy living and management using nutrition and diet therapy with over 10 years of practice. It is great to have you. You are welcome.
Thank you very
All
much.
right, so let's talk about most important thing. What is Alzheimer's disease, first of all?
Thank you for having me.
You're welcome.
So Alzheimer's disease is actually a brain disease, a progressive brain disease. It's characterized by changes in the brain, and then it results to loss of neurons and their connections.
Does it have a cure?
No,
So
it doesn't.
can only be managed?
It progresses.
It progressively
Yes.
gets worse. Can it be managed?
Yes, it can be managed because there could be other diagnoses that could result from this. So when we have a patient with Alzheimer's disease, we manage whatever symptoms it shows up with, and then manage whatever diagnosis that it progresses with.
Okay, just before we get into the dieting needs and all of that, what causes Alzheimer's disease? Is it something that we can prevent? Is it something that would happen with age?
Okay, so Alzheimer's disease doesn't have a specific cause, but it has risk factors, just because we cannot say this is a certain cause or this is what can actually lead to it. But we have risk factors like age. You and I want to grow old. So as long as you grow old, you are at risk for Alzheimer's disease. There are different changes that happens with age in the brain. So when that happens, you're at risk for Alzheimer's disease. There's genetics. Genetics, yes.
Plays a major factor in it, right?
Exactly. If you have a father who's had Alzheimer or a mother who's had Alzheimer, you are also at risk. I'm not saying that would happen, actually, but you're actually at risk.
Susceptibility ratio is greater.
Exactly.
For you to pick it up. Okay, so let's get into the...
There's also lifestyle.
There's also...
Yeah, and there are
let's
also
talk about
diseases. There are also diseases. Diseases like heart diseases, hypertension. You know, with hypertension, heart diseases, a person can get down with stroke, and stroke is paralysis. So that would happen from the brain, because the change in the brain is the loss of neurons. And neurons are those nerve cells that send messages from the brain to you. There's part of the brain where you can think, you can reason, you can imagine, put out a correct sentence, just like we're having a conversation.
No.
That part of the brain is affected when there is Alzheimer's disease. So hypertension can actually put us at risk for that to happen.
You said lifestyle. Are there
Lifestyle,
things that,
obesity,
obesity, or
excessive nutrient intake that could lead to overweight and obesity. So there are brain blood vessels that obesity can actually affect.
Okay.
That is also the brain. Whatever would affect the brain can actually put one at risk for Alzheimer's disease.
Wow.
Yeah.
Quite interesting there. Okay, so let's get to the diet, where you come in now. The dietary needs of managing it and all of that. How does one go about all of this?
Okay, so when a person or a patient is presented with Alzheimer's disease, be it home management or hospital management, what myself as a dietitian look out for is to look out for links or any other thing or diagnosis or symptoms that could present this person at a risk for malnutrition. Because with Alzheimer's disease, there's memory loss, which is what you and I know as dementia. A person can forget to eat. A person can forget the smell of food, even the beautiful...
when you say forget to eat, does that... when
there's
the
memory
hunger
loss.
pangs come?
There's memory loss. You do not want to go there. You do not want to experience.
And so I'm just trying to understand,
want to experience that.
would you still feel the hunger pangs?
A person forgets to eat. That means a person forgets every activity. There is no sense, there is no message from the head to tell you, I am hungry.
Hungry.
Exactly. So
now
that
I get a better
happens.
understanding
That
of it.
means the person is open to malnutrition. So a dietitian sets in or steps in to manage that other diagnosis. Like I said, with Alzheimer, you are also open to some other diagnosis, which is malnutrition. So when we come in, we look out for those links to malnutrition and then begin to work on that or manage with. This is a medical diagnosis, actually.
Medical, exactly.
Yes.
So that's why I'm coming in now. At what point does somebody start or understand that at this point I need to go for a diagnosis to ensure what it might be? Is it by medical checkups? Like can a general medical checkup reveal Alzheimer's disease?
So there could actually be changes going on. Like I said, risk factors, hypertension. A person can progress from hypertension to stroke. So when stroke happens, you must always go for, the doctors will check out for different signs. They'll see symptoms and they'll go further to say, I'm going to find out what is happening in the brain because there's paralysis going on. So there's no message, no transmitters happening. Yes, there's obesity. If there is obesity, then we know that there's a tendency that the blood-brain vessel could be blocked at that time because of obesity. Yeah, fat cells, fat droplets in the blood vessels can actually do that blockage and then cause that stop of message from the neurons to the body. So those kind of diagnoses presented can actually make a doctor say, yes, I have to check the brain. Or when a person is aged, coming to the hospital with different diagnoses, a doctor may be pushed to say, oh, I'm seeing this or I'm seeing that. I need to progress or I need to check further to see if this is
I bet
happening.
you an hour will not be enough for us to finish this. But please, I just need you to answer this. Are there lifestyle changes one can, take on that can help prevent this kind of thing or manage it?
Okay, so like I said, you cannot prevent it because you and I want to grow old. And then you and I have families that we cannot say if they have Alzheimer's disease. But what you can do nutritionally is to make sure that you're having an adequate diet, low fat, low salt, low sugar. Make sure that you're physically active.
What is low
Low salt?
Low salt is
very little amount of salt.
very little amount. Because someone like salt not
our daily requirement per day is a level teaspoon, which is about 2,300 to 2,600 milligram of sodium, which is what you and I need. So the MSGs, I'm not naming names anyways.
Okay.
So the MSGs, we're taking them out. We have to use natural spices and herbs, ginger, garlic, turmeric, cinnamons, we have them. Curry, thyme, we use them and then make sure that there's physical activity and there is brain-stimulating activity because it is believed that as you age, you have to read so that you
brain stimulation. So you do not tell somebody 7 divided by 0 and the person says 7. We will continue this. This is quite interesting. I am looking forward to still talking about this with you, but we have to leave now just because of time. Thank you so much.
Thank you for having me.
Expository talking to you.
Thank you for having me.
All right. Okay. Woo. So you see where is the problem? 7 divided by 0. Well, let's head over to the kitchen.